we would like to invite田梦琪、刘诗凯、张威, the panel directors for our mental health and well-being education panel, as well as their panelists, so we can speak on this very important topic. The floor is yours. Very well, thank you, Sky. Audience members, panelists, greetings to you all. Thank you very much for joining the Mental Health and Wellbeing Education panel. We have been established this is a school, a student organization that has been established and many years ago, and now are regarded as the most well-organized panel and today organization. And today we're actually going to be talking about reimagining education and reinvigorate aspiration, and we'll discuss the current situation and future of education in the spirit of fostering virtue through education. The theme of this panel is to let every seed blossom and see the individual psychological needs of adolescents in education. We'll discuss the development of mental health resources in China in the context of digitalization, hoping to help parents and educators realize and fulfill the psychological needs of adolescents in diverse environment. Now let's say hello to the directors of the panel. Zhang Wei. Hello, I am Zhang Wei. I'm one of the joint directors for this panel. I am a Master of Education candidate at Human Development and Education at Harvard Graduate School of Education. Thank you, Zhang Wei. Liu Shitan. Hello, my name is Liu Shitan, one of the joint directors for this panel. I am an ADM candidate at school counseling at Columbia University Teachers College. Welcome to the panel. Thank you very much to my two partners. I am also one of the joint directors for the panel. My name is Tian Mengqi. I am an ADM candidate at Human Development and Education at Harvard Graduate School of Education. Once again, on behalf of our team, welcome to this panel. We have been very fortunate to have invited to today's panel three wonderful panelists. Madame Yinghua Liu, Director of Kongzhen Mental Health. Hello, good evening or good morning to you all. We have also invited to the panel co-founder of Xinli 001, Mr. Li Ke. Welcome. Hi, greetings to you all. My name is Li Ke. I am a partner and co-founder of Xinli 001. Thank you, Mr. Li. We have also invited to the panel Ms. Yang Ruihua, Shenzhen Public School mental health teacher. Hello, I am Yang Ruihua. I am a mental health teacher. Welcome to the panel. Thank you very much for your attendance. We have 90 minutes today for the panel. We'll have the opening introductions, keynote speeches, interactive discussions, and closing. So at the panel, we'll ask the three panelists to present first, and then we'll have a discussion and Q&A. If you do have questions, please leave your questions in the chat box or in the live stream portal. We will choose some of the typical questions to address the panelists. We'll start with the keynote speeches. We'll ask these three people to share their explorations and practice in mental health education. We will have them speak about emotional disorders, the recognition and knowledge on mental health for adolescents, as well as social psychological services and school psychological services. Our first speaker is Miss Liu Yinghua. She is the director of Kongzhen Mental Health and is a licensed psychotherapist with 21 years of clinical experience, specializing in psychotherapy. She's going to talk to us about interpretation of adolescents' emotional disorder. The floor is yours, please. Very well, thank you, moderator, for the introductions. I would like to begin with my presentation. My name is Liu Yinghua. I'm the director of Kangzheng Mental Health. From 2001 to 2020, I have been working in a Tier 3A hospital in the Department of Psychology, and today it is my great honor to have this opportunity to meet you at the CES panel. I'm going to speak to you from a psychotherapist perspective, talking to you about adolescents' emotional disorders. So the first part, I'm going to speak to you in two parts. The first part is the characteristics and reasons behind the emotional disorders. I'm going to share with you a case study and see what clinical characteristics this disorder would have. Okay, so what are some of the commonly seen emotional disorders for adolescents? Depression is one of the most commonly seen one, and we pay a lot of attention to it already. So it included from mild to severe depression conditions that would require hospitalization. And to the other extreme, we would have adolescents who would be very excited and very irritable, and there are some compulsive behaviors. There is anxiety, and most commonly seen in the form of social fears and difficulty of communicating with people and talking to people, and would have a fear for any socializing scenario, and there would be compulsive behaviors such as trying to peel off skin or trying to pull at their own hair, and hoarding. All of these are considered compulsive disorders. And this is something else that is quite commonly seen. For adolescent girls, there are also eating disorders that is deeply connected to their anxiety with regard to their body shape and weight. So they would have bulimia, anorexia, as well as vomiting, insomnia, and waking up really early, so they can only sleep for a couple of hours and then would wake up and find it very difficult to go back to sleep. Some people would have very bad nightmares that would make them too scared to go back to sleep. And also for preschool children or school-age children, they would have ADHD and other attention disorders. There is also addiction to the internet and some other impulses for self-harm. All right, so you will see some data on this page. In 1996, the prevalence of depression was 0.05%. In 2008, in 12 years' time, this has reached 13%. So there was a 120 times increase over 12 years, very high. And most recently, in 2020, Cass Institute of Psychology has released the Mental Health Development Report for Chinese citizens. This has shown that the detection rate for adolescent depression had reached 24.6%, and 7.4% of that is severe disorder. So at our clinics every day, in every 10 patients would have 7 to 8 depression patients. Okay, next, on this page, we're talking about some of the specific symptoms, and I would like to share with you a case to talk about some of the clinical characteristics of disorder. This was a 15-year-old woman, girl, and she had talked about being in a very depressed mood and was never cheered up and has been self-harming for 5 years. Her parents had opened a small grocery store, and it's a small family business. The parents have pretty bad relationships and would argue, and there is also family violence against the mother by the father.
But actually, this girl is a very a good child in terms of grades from grade 1 to 3, but only when this child was ranked number one in the class could the on parents feel happy and then would reward her with a good meal. And this girl always felt she was only worthy when she could achieve high scores. So she did nothing but studying. She never talked or interacted with others. She only just went to the bathroom during classroom breaks and would just come back to study or try to memorize all the facts and English words. Interestingly, she never talked to her desk mates after having quite several desk mates. She never actually remembered their names. She could not even remember who her desk mates have been because she has been very isolated, and also her family is quite financially constrained. She started to come to me at grade 4. She then realized that she's rarely happy. Even when she got the first place in the exams, she still could not really feel the joy. And once she took up the courage and told her mom that she wanted to see a doctor and she didn't want to live anymore. And her mom said, "You're so young. What are you upset about?" "I am actually upset. Perhaps I should send you out to work on a construction site. Then you will forget such nonsense." And the girl didn't dare to mention that again. And that situation lasted till the end of the primary school. The child managed to get enrolled in a very good middle school in one of those best classes in the grade. And but that class was full of good students, and it was much harder for her to get number one in all exams. And that was a lot of pressure for her. So she always studied until 1 or 2 a.m. in the morning. She was so dedicated to studying. And she just wanted to study hard. And then she found it difficult to study. Why? She felt she was not quick enough at answering questions all of a sudden. It's if her brain was rusty. She said sometimes she felt her brain was full of glue. It just could not operate. She could not study efficiently. Then she really plummeted. All of a sudden, she fell from number one to below 20th in the ranking. And then her parents were called to school. At that time, she did not hold on her tongue. She did not silently cry. In the bathroom, she screamed and she even swore at her mom. And she then just threw everything on the desk and onto the floor. She locked herself in the room and refused to eat or talk. And no matter how hard her mom tried to talk to her, she would not respond. Instead, she just harmed herself with cigarette ends and knives. And when she came to me, I saw that she had already cut her arms and legs, and these cuts were new or old, and some of them were really old. And 2 to 3 months before she came to me, she stopped schooling because the schooling would make her feel headache or even feel sense of death. She could not breathe and she could not feel her arms and hands and feet. And that's how she was actually sent to the ER by the school nurse. And after that happened 3 times, ER doctor said, "I think we've checked you inside out, including cardiologist. I think you should actually see a psychologist." And that's how she was referred to our department, and we started to admit her. And after seeing her, we saw that depression usually takes about 2 weeks to be diagnosed, but for her it had already been 5 years and she could not attend school anymore. And basically, you see that most of these symptoms on the slide were presenting her, including, even physical manifestations and also self harm and thoughts and behaviors. And so we diagnosed her with depression disorder, and she was administered treatment accordingly. Next. And what are the reasons or causes for adolescent emotional disorders? Well, that is a question I get quite often from parents and children. Maybe on children wonder, do I feel better when my parents are just happier with me? Is this genetic, hereditary? And actually, many psychological and mental disorders, especially when it comes to mood and emotion-related disorders, don't have it clearly defined causes, and also they do not have any biomarkers such as a tumor that can be dissected for a clear diagnosis. When it comes to emotional disorders, it's related to biology, psychology, society, and a culture. So it's the interaction of all factors. Let's start with the psychological factors. Well, we said, it could be related to genetic reasons. If one of the parents has history of disorders such as, anxiety, schizophrenia, bipolar, then the chance of the child has emotional disorder is higher. And also it could be caused by disrupted transmitter status, the foundation for us to prescribe new antidepressants today. And it is likely that some neurotransmitters such as dopamine and it has a decrease in terms of concentration. That is why we try to rebalance and the level of transmitters with the antidepressants, but antidepressants actually need to maintain a certain level of blood oxygen concentration. So it usually takes 2 weeks before the efficacy shows. And also we often talk about the hormone level change in adolescence, especially estrogen. And that also make it more likely for female adolescents to have depression. And next it would be, personality related cause. That girl that I just mentioned tend to be more pessimistic and paranoid. And that is one of the reasons that she's more susceptible to depression. I also realized that professions of parents are related to depression in adolescents. Let's say if teachers, doctors, police officers, and civil servants are professions where parents are often perfectionist, overly self-disciplined, rigid, and these characters and parents also have an influence on children. Those are personality related, and also family environment. You already heard about the case. Well, if the family fails to provide enough support, the family neglects or even rejects the child, very often it's likely for the child to develop a depression. Next is peer relationship. We know during adolescence, one of the main development task is to develop unity within oneself, and that has to be given enough attention. And this kind of self-recognition is often based on external comments, and not from parents, but rather comments from their peers. And they carry a lot of weight. If at this time, there is school bullying or being excluded by the peers, it could trigger emotional issues. And that is one of the red flags. Next slide. Can emotional disorders be cured in adolescence? Well, first, the answer is yes. Bipolar depression can actually be cured, but they tend to relapse relapse easily. So relapses are not uncommon. That is why I would like to share with you some clinical experience so that as families and caregivers, you can notice and detect the signs first. We should know where counseling and psychological services are available, and when in need, you should go and talk to professionals in hospitals so that they can tell you how severe the situation is. And with the proper diagnosis and assessment, we can help you with the appropriate treatment plans. Second, what should parents do? I often recommend parents to watch on and read things related to the disorder. Often recommend depression, eating disorders, and ADHD related materials. And I always remind them not to just simply tell the children to feel better. Instead, they should be listeners and they should listen to the story of the children. And once the relationship between parents and children gets better, then you try to talk some sense into the children. Otherwise, it's only counter effective. And next is to you build up your knowledge repertoire about these disorders. I recommend parents to come to me with a notebook, which should record the situation of the child in a chronological order. And I see the more trusted that we get from parents, the better on the efficacy is on if it is on an underage on a patient, and the meds can only be taken with the supervision of the adults, and for boarding students that they can only take 3 days of medication with them, and because we've had situation where children overdose themselves when they were prescribed too much medication at once. And when a patient has the thought of self-harm or even action, we definitely should not leave them alone. They have to seek help from the professionals. My experience is that these children who have history of self-harm and even suicide should get my contact directly, and in time of crisis, they can reach me on even in the middle of the night. Lastly, I want to say on that apart from medication, I also would provide individual-based treatment and also family interviews on if the child is a victim of bullying or the child is from a family where the parental relationship is very strained. I want to see through family interviews how the child interacts with the parents, and then I can understand what went wrong. And those are family-based therapy. And thank you very much. That's all my sharing. Thank you very much, Ms. Liu, for the wonderful sharing. I hope and now you understand, the what the family can provide, and also the causes and presentations of psychological disorders. And next, we will have Ms. Li Ke, and, and as the next speaker on and Mr. Li Ke, a co-founder of Xin Li 001, and he has been working in the mental health field for 15 years, and he is committed to innovation and promotion of psychological services. He has developed the online radio station Psychological FM. Mr. Li Ke also published the following online service resources, including the 1-Minute Psychology series, Psychological First Aid Manual. Well, no, good morning or good afternoon. I am Li Ke from Xingli 001, and I would like to also talk about mental problems among adolescents, which are rather serious. But what are the solutions available today? Let's see what solutions we have in front of us.
Before we started working on Xinli 001, we have had a major psychology group, and there was a post that said, I have drank half a glass of Shiwas and more than 40 Tylenol pills. What do you think? And then people as the administrator of the chat group, our founder had become very anxious because professionally an alarm bell was rang. It looks like the woman was trying to find a way to harm herself. And so many people saw the post and wanted to help the girl. In order to help the girl, the first issue to deal with is where she is and who she is. So we used many different methods, and in the end, we used the Taobao website and found out about her contact details and her address. And so we called the local police and gave the information to the local police, and the police thought it was a prank and did not really believe that this was what was actually happening. So we made one call and the police wasn't responding. So we made a second call, a third call, and many calls were dialed in from around the country. And so the police became alerted and made the decision to go and check it out. And so they went there and knocked on the door of the family home, and the parents of the girl came out and was complaining, why are you knocking on our door at this late hour? We were already in bed. And the police said, do you have a daughter? Yes, we do. Okay, so we received phone calls from netizens that told us that your daughter might have taken some meds and she was committing suicide. We must go and check it out. And so the parents then immediately went to her bedroom, and we went and the girl was already unconscious. So ambulance was then called and she was taken to the hospital. And fortunately, she was revived after she was taken to the hospital. And we understood why, the reasons behind her suicide attempt. A day before, she broke up with her boyfriend and she took an extreme choice. And this was something that happened 10 years ago. And at that time, it had received a lot of news coverage. And then I'll share with you some data. And you can see that for adolescents, mental disorders, the prevalence is already 17.5%. The detection rate for depression among adolescents was 24.6%. 27% of middle school students have experienced self-harm or conducted self-harm. So that data is something that shows us a very severe situation. For adolescent issues, we can now say that it is the elephant in the room. The issue is big, the issue is severe, but we often overlook it. Why is that? There is a very important reason behind it, because we actually look at mental disorders, depressions, and other types of psychological issues. We don't have a lot of understanding. We don't have a lot of contact or knowledge. We often see someone who seemed quite cheery, but he would one day come out of the blue and say, I have depression. You wouldn't even believe him. But we do have patients who have depression but are always smiling. So it is something that we don't have a lot of knowledge on, and we can't have early detection, and that makes the problem worse. In addition to that, we might know about the problem, but we don't dare to actually face the problem head on. So we would rather neglect it and deny its existence. And for adolescents, for their mental health, the situation is already severe. And there is another problem behind it, which is the prejudice and stigma associated with mental disorders. I don't know if you have visited mental hospitals or tier 3 tier 3A hospitals in the psychology department. There is a table and a rubbish bin next to the pharmacy window on that floor. Why do we have that? There are many patients who've come out of the clinic rooms and they go and get the meds. The first thing they do is to take off the box and rip off the label on the bottle of the medication. Why do they do that? Because they don't want others to know that they're taking mental health medication. And so when the society attaches this much prejudice on the mental disorders and give them so much stress, they dare not face their own problems. They dare not share the issue with others and ask for help and consideration. This is a very difficult situation. And in our culture too, there is a big prejudice where when we wanted to be unfriendly to people, hostile to people, we will say, you're a crazy person. You have run out of asylum. This kind of language is actually stigmatizing mental disorders and mental patients. And when we talk about psychological services and its effectiveness, when we realize there's a need for help, the next step would be, how can we go and find quality consultants or counselors or psychotherapists? There are actually more than 300,000 practitioners, but among these counselors, those who can really provide effective services and therapy would be less than 5%. So perhaps 50,000 to 100,000 therapists. Many people would think of the entry point as very low, but that is not true. It is too far from the truth. It is an area where you would need to have a lot of training, many hours of training and guidance and mentorship before you can become a quality counselor. So it is actually very difficult to come into this profession. There are so many counselors, on the other hand, in China. How do we then find those who are actually qualified and capable? So we would screen the practitioners and find the good ones. We have set up a set of criteria. We would compare the hours they've worked, the number of cases they've done, the hours of mentorship they've received, and in the end, we would select a few hundred therapists who would meet our standard. And to find an effective therapist is a key to access to that quality service to adolescents who suffer from these conditions. Affordability is another issue. As when we realize we need to seek professional help, when we realize we need to have a counselor, many people would be scared by the price tag because an ordinary counselor would charge 200 to 300 yuan per session. And for the better counselors, they would charge 700, 800, or even more than 1,000 per session. And with these consultations, you can't do it for once or twice. Usually the short-term sessions would go for 10, 15, or sometimes a few dozen or more than 100 sessions. So it actually adds up to quite a significant amount. Sometimes you would have to spend close to $500,000 to receive that treatment, and this becomes a huge financial burden to the patient and their families. So the cost is actually a very big obstacle between the adolescent and quality psychological services. The next question is, we would like to share with you how we could find inclusive and effective psychological services. I would like to talk about this from two aspects. The first aspect is, in the past, there were many schools, and include now, there are many schools today. They're starting to pay attention to mental health of their young students, and they would provide training, they would provide awareness raising sessions, making them understand or help them to understand what the problems are and what they can do to help themselves. And this is led by the school and given by the teachers, and the students are more passive. And the sense of participation was minimal for the students. So can we actually change the perspective to have the students themselves conduct these sessions, for them to be the main driving force for these campaigns? Something that brought me these thoughts were my experience last year. I had a group experience with some year 9 to year 10 students. They were doing some research on emotional disorders, and they were looking at the nature of the disorder and what they can do, what are the symptoms, what sort of help they can actually gain. So they have formed a research team, and that research team has distributed the tasks across the different members, and everyone was very proactive in completing their own assigned tasks. So they would go and speak to experts, they would do literature review, they would look up data, and in the end, the entire process was recorded by them as well. So when I see what they were doing, I was very impressed, because number one, what they were doing was far beyond their age, because in my understanding, you would at least be a university student or even a postgraduate student to be able to do research at that level. And as they were doing this, they were very, very dedicated. And this was something that was very surprising. They lived in Shenzhen, and for that research, they have traveled to different universities. They went to Guangzhou, they went and interviewed experts. And in the end, they had produced a high quality video. And when I was watching the video, I thought, I can't imagine this was produced by a group of young middle school students. So we can trust our students. We can trust our adolescents. They have the potential to do something well like that, to raise awareness. So how can we provide inclusive, effective psycho services? We can provide to young people services in two modes. One is training, the other is counseling. Each would have its own shortcomings. For example, with training, many people, when they received the training, they came as a learner and a trainee, and many people were not motivated enough to learn. There actually needs to be a very strong motivation behind these people. And also learning is something that is anti-human nature. Students were already learning all the time. So for them to do it for 1 day, 2 days, 1 semester, or the whole year, it actually is very taxing and very difficult to continue. There is another solution that can help solve it. The skills can actually be standardized and the price can be affordable.
Well, in the past 2 years, there's a new therapy called digital therapy. If you are familiar with this concept, you can see it as a new type of on digital medication. So in the future, maybe psychiatrists can prescribe digital meds as well as traditional meds as we know them. There are already businesses that work hard on such innovation. I think we need services that are affordable by most cohorts of the population, and that is what I expect the most. And that is all of my sharing for today. I know that we have interaction sessions later, and I look forward to talking to you all. Thank you. Thank you very much, Mr. Lee, for a presentation on the adolescent mental problems and solutions. And next, let's give the floor to Ms. Yang Ruihua from the public school in Shenzhen City. And her topic is, what does a child need from us? Ms. Yang serves as the host of the Mental Health Education Project in Longhua District of Shenzhen. She's also awarded as one of the district outstanding teachers. Currently, she's a school counselor and a virtual education director in Heping Primary School. And as excellent party member, she's appointed as first secretary of the Junbei Elementary School, bring more resources to private schools in Shenzhen. And now the floor is yours, Ms. Yang. Hello, everyone. I'm a counselor at a public school in Shenzhen. My topic is on how to make every seed blossom. I'm a teacher and a counselor. My mission is to make sure that everybody in the school will blossom. But in the very beginning of my career, I was quite confused because I did not share the same understanding as I do today. 20, 30 years ago, school counselors really were very new. And as of yesterday, I did some search on it today. You know, a counselor is still not recognized as a teacher, according to the Chinese Wikipedia. And I found that really confusing when I started my career. And I decided to look for an answer because many questions can only be answered as we experience life. I found a boy called Xiao Mu on grade one who's taller than his peers. Whenever I walked into a classroom with new materials, he would be really thrilled and started to scream. Yes, you heard me right. He would scream because he did not have any speech skills. My understanding of the autism back then was restricted to what I learned from textbook. I studied psychology, which is different from counseling education. These two are different majors. In the very beginning, his mom would accompany him for half a day, and then and she realized how challenging the kid was, so she would stay with him throughout the day. And at that time, we did not know on this concept of shadowing teachers, so we had the parents sometimes and the grandparents to accompany him. And one day, I talked to the mom and asked her when he was diagnosed with autism. She was silent for a while, and then collected her thought and said, after kindergarten, I took him to the hospital. He never talked, but I was hoping that one day he would start to talk. And my friends always consult me that it's just a matter of time. I said, boys start to talk later. And in kindergarten, in the beginning, when he was screaming, the teacher thought it was because of her, personality, or he had a problem of adapting. But after 1 year in kindergarten, it did not improve. And the teacher realized the kid may have more issues than just adaptability and suggested me take him to a doctor. And then the mom started to cry because for years she did not want to face the truth. She buried her head in the sand as an ostrich and missed out the critical period for the child to develop speech. I then asked her as I handed her a tissue what she wants to do. And she says now the child is receiving proper therapy and also training for speech. And she only hopes that the child is not excluded by others in school. And I said, I understand you. And I would try my best to protect the child. And they talked to the headmaster of Xiaomu's class, who had been in that school for 10 years. And she also loved Xiaomu very well. And that was her first experience with an autistic child as well. She was also very confused. She did not know how to really interact with the child so that someone would not be isolated. I told her it's not difficult. You know, the attitude a teacher carries towards this child really affects how everyone around the teacher reacts, and she immediately got it. Well, in her class, no matter what reason she could have to praise anyone in class. You know, the kids would guess, oh, you know, someone who behaved very well and someone who got a high score. And the teacher would always say, I want to praise Xiaomu because, you know, Xiaomu is never late and Xiaomu is always clean and tidy. And Xiaomu smiles at me every day. Or she would say, oh, I found a very beautiful shell. I'm going to give it to my favorite kid in class. Do you know who that is? You're right, it's Xiaomu. So this headmaster was never shy about showing her affection towards Xiaomu. And gradually, these young kids also did not find Xiaomu strange. They just found, well, sometimes Xiaomu would scream, and Xiaomu could be loud. It's normal. It's just different. Kids never really minded when Xiaomu sometimes would stand up and walk around during classes, and other children just saw that as a kid who needed to do that. And then everyone in the class wanted to help Xiaomu as the teacher's most favorite child. When Xiaomu ran out of classroom during class, other kids would go out and guide him back. And that's how Xiaomu really grew in love. And that's how adults can affect children. When a child needs support at an early age for public schools, teachers need to support that, and teachers also need guidance in terms of methodologies. And I only told this teacher a very simple tip, but she managed to really change the life of Xiaomu and provided Xiaomu all the safety and the love as Xiaomu went through primary school. And when parents and teachers need help, school counselors can actually help. We can also help with the needs of children with special needs, but sometimes I'm also challenged by the fact that mental health is not included in the mandatory curriculum. On the other hand, in terms of professional, code of conduct, we cannot provide counseling services because there is a conflict of interest if we're both teachers and counselors. And I feel, I'm wasting everything that I learned in the past because all these, therapy and psychology knowledge and skills that I have cannot be put into use. But now I can help the adults. And there was a story that really cured me. Well, thousands of years ago, there was a famous doctor in China called Bian Xue. All his family members were doctors. one day, someone asked Bianchi who among all the doctors in the family were the best, because all three brothers are the doctors. And he answered, I'm the worst. My eldest brother is the best, and my second elder brother is the best, is the second best. And then this person said, we only heard about you. Why are you the worst? He said, my eldest brother treats the patient before the illness would appear. The brother would prescribe some medicine that could prevent that illness from happening. That is why he never got recognition, because no illness was ever cured by him. But everyone in the family praises him at the highest. My second brother always cures patients when the illness just starts. But at that time, it's just a minor discomfort. And so my second eldest brother is very good at treating small illnesses, as people understood it. But for me, I treat patients who are in excruciating pain, and the family members are really anxious and worried, and they come to me and they see how I practice acupuncture and use one type of poison to get rid of another type of poison, and even perform surgeries. They see the big operations from me, and that is how I am famous. And that story really struck a chord with me. And of course, as a therapist and a counselors, we feel a lot of sense of fulfillment. Well, now I'm in a K to 12 school, and I'm accompanying them the last stage of their childhood. Freud once said, all problems originate from childhood. If we can be like the two elder brothers of Bianxue and can cure problems before they really escalate, that would give us the highest sense of pride and joy. After that, I found my consolation, and I did not want to become the famous Bianchi, but rather the first or the second brother of his. Whenever I see red flag, I talk to the teacher or parent and ask them to make small adjustments so that these problems can be nipped in the bud. Also, I am dedicated to popularizing simple ideas about psychology and counseling so that adults know how to get along with children and also help them sail through their childhood and adolescent years. That is the fundamental solution to reducing probability of the occurrence of mental disorders. So every Friday, I host salons on psychological disorders and mental health. In the beginning, I only had a handful of parents that would attend, and then I had hundreds. I had to even rent a bigger space for workshops after I had my second child. During on my maternity leave, I decided to record sharings. That was long before TikTok and social media. Me and my good friend Chen Yanqin recorded family interviews for about 1 year and one every week. So in total, 50 episodes in that year. And then I changed the school, and now I work in the Dunbei Elementary School. And I once again started to think how to really provide effective changes. It is actually very difficult for adults to change, especially that sometimes it's just a one family member that attends the workshop. And other family members don't understand why this person all of a sudden comes back from a workshop and wants to change everything. It's difficult to change an entire family. But the ecosystem theory gives me the inspiration I need, which it says a child grows up in a large ecosystem, which includes a family, a school, a community, and society, which influence to the child from different aspects. And I want to optimize the ecosystem from two angles. First, we want families to form a community. They can read, hike, and do sports, visit museums, and do volunteer services together, with the purpose that children can access people outside their families. Similar to extended families in the past, parents, grandparents, uncles, aunts, cousins could all accompany a child's growth after urbanization. Core families are more prevalent. Core families having only 4 or 5 members, and the influence of parents is significantly enhanced, and that is good and bad depending on whether it's the strength or shortcomings that are actually magnified in the children.
So it is extremely necessary to expand the children's social circles to give a more enriched content. So they would be able to see how other parents treat their children, and they would actually be influenced by that. In Africa, people say it takes a village to raise a child. That's what they meant by that. And so I have parents who have shared with me that they have gained a lot with these group activities. In the very beginning, they might think, why was my child so introvert? Or why is my child so talkative? They see a lot of the shortcomings on their own children. But after they organize these community groups, they have found that every child is different. Some children are actually very, very diligent and scores really high in their schoolwork, but never really takes part in any social activities. They never organize their schoolmates into a game group or something like that. And there are children who don't really do that well in school, but when organizing activities, they can find that their children have very strong leadership. They can actually call on their peers and their classmates and other friends to join into the group games, to go hiking together, and they would also work as wonderful MCs in some of the group activities. And so each child is different, and parents used to think that other children do better than their own. But in these organizations, in these events, they can see the different sides of their children. They know that their own child has shortcomings and has strengths, and other children too are like that. So it changes the parents' perspectives. And this also trains the social skills for the children. Some parents would say at the beginning of these group activities, many children would have arguments when tasks are being distributed, when rewards are being distributed. Many children would cry, and with these activities, they would have a child crying at the beginning, a child crying in the middle, and a child crying at the end. But then very slowly, they see their children begin to learn how to work in a group, how to obey rules, and how to accept rewards and penalties. So the children learn through these interactions how they should behave in a public space shared with other people and how to deal with conflicts. So these groups brought a more enriched ecosystem to the children, improved their interpersonal skills, and also would make up for the shortcomings of their own family situation. Another way that we do this is to bring reading into the family. So in a family, we want them to own more books, create an atmosphere that is book friendly and reading friendly, and build a new family habit. It is difficult to change a family's habit, but once you introduce reading into a family, it's actually relevantly comparatively easy. So the children would have a new hobby. They would continue to engage in a dialogue with the writers, and you basically open up the doors to a new world, and more people can influence the child's development. With these premium and high quality books, the authors are wonderful people that have a lot of good things to share, and these people become influencers for the children. And if the parents and the child read the same book, this is also a process for them to build the same value system, and also it is a way to resolve or soften conflicts and disputes in the family. So I've been doing a lot of that work to recommend books for families with children, and I have recorded more than 300 short videos videos doing that. And I often receive messages from parents that would say, thank you for the recommendations. My children love certain books that you recommend. And we have been learning from you for years. We've been listening to your audio, watching your videos, and before we came into your physical classes. So over the past 10 years, I have not really received a lot of awards or being called an excellent teacher or something like that, but I have helped families to deal with the difficult issues as they educate their children, and that is a great sense of achievement. Last year, I was selected by the Party Secretary Program by Shenzhen Longhua District, and it gives me a lot of opportunity to get in contact with the new community. And this new community is made up by the harder working people in Shenzhen. They usually have 2 or 3 children per family. They don't have a lot of rooms. Children don't usually have their own rooms. They have to share. And the families don't have books. There's no atmosphere for reading. So the parents to these children are very hardworking people. They work very hard, long hours, and very busy, but they share a common trait, which is that they're trying their best to provide for their children the best, to the best of their ability. They don't have time to accompany their children. They don't have time to learn how to keep their children company. And this is a new challenge faced by us. To these children, the education resources provided by their families are very limited. So we were exploring what public resources we can bring to them. After I graduated from universities, I rarely go to a library. I would actually buy from bookshops or online. But after I got into contact with these students, I went to all the public libraries, and with the aim of picking out good destinations for my children to go and spend time during their holidays. And so in winter holidays, I help them to complete a project, which is to read a book every day and record that achievement. So I do have students who were able to keep on reading every day throughout the winter holiday, and that really is very touching. So every child has unlimited potential, and we need to help them unearth it. Every family is different. Their children are different. They face different problems. As a mental health teacher, what we can do is to see them, see their needs, and use every resources we have to provide them with support for their development. And this is something I would like to share with you today. Thank you for your attention. Thank you, Ms. Yang, for that wonderful sharing. We have listened to Ms. Yang before, how they expanded, adjusted, and restructured the mental health support in the school scenario, and these would bring disruptive changes to the children, and this could be more encouraging to more educators to come and join in this field. Thank you very much for the wonderful presentations, and hopefully what they have shared with us will help us to increase our awareness on mental health for adolescents and bring more inspiration for the society to provide more resources. We'll go into the Q&A session, and from the enrollment forms, as well as some of the comments left by audience, we have collected some information and questions, and we are going to raise the questions on behalf of the audience members. Thank you for joining the Q&A session. The first question is, under today's backdrop, what sort of changes do we need to make to the mindset as we provide mental health education to young people? We would like to direct the question at Mr. Lee first. It's a wonderful question, really. Regarding this question, we have had some peer discussions, and we face a similar question. Why is it that there are more adolescents today with more mental health issues? Is it because today's children are more vulnerable? They were not as tough as children in our times? Is that the fact? Actually, I believe This has a lot to do with the great changes that's happening in our times. First of all, children in today's world are different to us when we were children. We had a sense of scarcity. What does that mean? In many aspects, we don't have satisfaction when we want something. So for example, if we wanted to buy a toy, when we were children, we might not be able to afford it. But today, if a child wants a toy, the parents would very easily satisfy that demand. My child has a room full of toys. So today's children can have access to many, many things, and it is different to our childhood. And today's children don't have that sense of scarcity anymore. They're easily gratified. And this is the first difference. Looking at children today, they face a lot of challenges that are also different to our times, and there are more challenges today. They were born into the information era. Every day as they turn on the mobile phone, they'll see many different short video clips, a lot of information coming at them, overwhelming them. And for young children and young adolescents, before they form a mature set of values to make judgments, it would create a lot of confusion. So if the children didn't have enough ability to make correct judgments, this would lead to a lot of confusion and a lot of psychological issues. And this is the first point. The second point, in the past, we usually would look at mental health issues as something that's bad. Usually when we think about it, the first direction we go to is how we can get rid of it. Maybe I'll need to drop out of school to deal with depression, for example. But I want to talk about this from a different perspective. Diseases themselves might be beneficial to us. Take myself as an example. I would write often and create videos, but as I create these things, it is a very painful process. If you don't have inspiration, it's difficult to create and difficult to write. Many great writers and scientists, as they create great works, they were usually in a very, very stressful and very extreme situation that's usually quite harsh. So I'm not trying to say that you should have mental health problems so you can create. I am saying that mental issues might bring benefits. We don't always have to eradicate it. And in today's era, we might learn to coexist with mental issues. Today's young people, the adolescents, we've talked about this before. In the material side of things, they get complete gratification. And if we look at the human demands, once material demands are satisfied, people would start to have demands in the spiritual level. And today's young people face this problem because they would have a lot of challenges on the spiritual level. And we can't really eradicate problems that come from that. So we can actually learn to coexist with it. In today's era, I believe that is something we can do to change our mindset. We don't really have to eradicate mental problems. These are my views. Thank you. Thank you, Mr. Lee, for that. That's a wonderful answer. He talked about how in the information era, the screening of information would be very difficult for children. And as they create their values, they need time. And we as adults can also improve from that. Ms. Yang, would you like to talk about your point of view on the same question? Yes, thank you very much. Mr. Lee had talked about this already. Our era has an excess of everything, information, material, everything. It there is an overload of information, explosion of information, and that's a major challenge to our children today. If it's a challenge, then educators like ourselves who work with children would have to face that difficulty as well. We must adjust our own scope and also shift the priority. In the past, we want to help children to understand themselves, to adjust their mood. But in today's world, we actually need to have a lot of other key content, which is to coexist in today's world with all the new things. For example, we need to learn to use the new tools such as short videos. We are not simply telling the children that you can't be attracted by the videos. We actually need to help them to understand how to use short videos as a tool, so they are no longer slaves of videos, but they can actually harness the power of the videos. We can encourage them to become producers, and so they can understand that certain content would receive a lot of applaud and they would change the way they think.
We want children to have the comprehensive and the correct self-image. Now they have feedback from different channels. One student of mine on it actually records videos of himself making Lego. And these videos got lots of comments and likes on the internet, and that encouraged him a lot. He learned that Lego is more than just a game. This is a skill of mine because I receive a lot of positive feedback from internet users, and that helps with his confidence. So self-confidence can come from a lot of different sources. So in the new era, on the one hand, we need to see what information the child is exposed to and give it the values, emotions. We need to know where they come from. Second, we need the children to know how to interpret the information. They, instead of passively receiving the information, they also need to learn about the concept of marketing. Or they need to know why they're attracted to certain information, so that they know what this information is targeted at them, so that they have a critical eye at information pushed to them. Next, we want the children to learn how to stand in different shoes, so that they can be information producers rather than just a mere receivers. Thank you. Thank you very much, Ms. Yang. As you rightly pointed out, as external feedback increases, parents and adults and teachers need to teach children how to identify the information and shift their perspectives and angles. Next question is, families in different background actually have different access to resources. How do we really provide psychological support to them to increase cross-generational understanding? And first, Ms. Liu, please. Thank you, Mengqi. I see the question. I'm a clinical therapist. In my clinic, give it a first time or on a veteran patient, I always talk to parents first. That's my opportunity to educate them. Parents ask me how the medication works, what are the side effects, how long the medication should be taken, and what are the side effects if the meds is taken with other substances, and how to improve the parent-child relationship, etc. So when I receive patients, I take some time to talk to their parents and answer their questions such as those. I also recommend them resources for further reading, for example, Xinli 001 and Tencent, as well as materials such as movies about parent-child relationships, and also workshops where we talk about ADHD. We that is very similar to group therapy for parents, and during these sessions we talk to parents about what they should do when they see behavioral problems in the children and how they can derive strength from one another. Outside clinic, I also arrange on family visits. I really am a strong advocate of family interviews because without trust from parents, we can only do this much. As you know, they each session is only 1 hour, 45 minutes, and they come only once a week. So in 1 year, the children are only with us for about 50 years, so yet they spend a lot of time with parents. So we need the trust from parents in order to have a collaboration with the family to help the children. Next, interviews with parents are not to only discuss on familial structures and the functions, but also how every person sees this issue. I ask them whether this child was actually expected or came as a surprise, and what the parent what did the parents treat intimacy and their adolescence in the past. Everything is related to relationship, and only when relationship improves can the parents serve as role models and supporting figures. And that is what I would like to share with you based on my experience. Thank you, moderator. Thank you, Ms. Liu. As Ms. Liu said, we as practitioners can actually help educate parents on and improve the relationship between parents and the children. Thank you again, Ms. Liu. Next, we're also very honored to have Mr. Li Ke to take this question from a different take. So, Mr. Li, please. Thank you. I really like what Ms. Liu just shared. I want to add 2 points. First, as a therapist, a counselor, or roughly a practitioner, we are well trained about psychology. When we pass on such knowledge to patients, give it children or parents, how should we appropriately pass it down in a way that the messages can be delivered effectively? We are professionals. We tend to speak about jargons and terminologies that are lost to our audience, or at the very least, it's difficult for them to fully comprehend their meanings. And parents have different levels of education. Some are university professors, but some are not. If this parent only received a very basic education, and we are all about psychological terms, they may not understand what we're talking about, thus increasing the distance between us and the parents. That also undermines the effects that we hope to achieve. As professionals, how do we translate our jargons into common people language that is similar to pop science? Some are very good at pop science, and yet some try to do pop science, but their concepts are still found to be really sophisticated or too sophisticated to understand. So what I'm trying to say is now, if there is a parent that wants to learn more about psychology, now is the golden age. In the past, when we wanted to attend a workshop about psychology in person, offline, it would be very costly. It would be thousands or tens of thousands RMB sometimes. Now internet has revolutionized everything. If you want access to psychology, a workshop, you don't even know what to choose because there are too many, but they can still be costly. On But there are also workshops and resources that are much more affordable compared to the past, but how to choose the ones that are most suitable to your situation and that can really be helpful to you. And that's also an important question. There are more options and choices for parents and patients now on the difficulty lies in how to make decisions. I always want to choose the best resources. If I really set my mind to learn about something, so I want to find the expert on, and that is also my recommendation to everyone who seek on relevant knowledge and resources. That is all. Thank you. Thank you, Mr. Lee. And he just pointed out how should we translate our language to common town that can be understood by the parents and the children, so that the messages can come across so that we can actually deliver help to those in need. But my next question, well, I think Mr. Lee already talked about that in his presentation, which is how can technologies be combined with mental health and well-being education. Well, Mr. Lee, would you like to elaborate from your own presentation? Thank you. And this is a very forward-looking topic, and I'm very interested in furthering discussions with you all. How to combine technologies with, let's say, therapy. My understanding of technology is that it can be divided into two groups. The first group is about efficiency, and the second is about invention, such as invention of species or therapies. And now a lot of elements of technology are related and connected to well-being education, therapy, and counseling. These could be platforms that using internet, such as training courses and workshops. And these used to be offline completely, but now they're online as well. And that has increased the supply of resources and broken a lot of boundaries of time and distance. So fundamentally, this conversion from offline to online has improved the efficiency of resource provision. And the other kind of technology would be invention of new therapies. After the marrying of technology and therapy, we can produce entirely different results, as I mentioned. And that could be the third possibility after an education and therapy. Well, now we often talk about digital therapy. It started 2 years ago, and investors have really been, looking at how this is developing. What could digitalization do to therapy? Well, first of all, it can produce digital medication, which may be as effective as traditional medication. However, it does not to be physically taken. It's a digital medication. The exercises that a patient practices and the task the patient needs to fulfill. Let's say insomnia is the problem a patient suffers from, or ADHD, ADD, depression. It could be other disorders as well. In the United States, the FDA in the year of 2020, when COVID just started, actually approved a few digital medications on it using the fast track. So digital medication could be prescribed by certain doctors. But I think digital medication is still far away from our everyday life. First of all, we still need to wait and see the efficacy of digital medication. Second, digital therapy. And it needs to be rolled out at large scales, but how do we do that? And how acceptable does it, or will it be perceived by patients? And we need to answer all these questions. And next, I want to share with you on and a few other thoughts about the combination of a technology or digital medication with psychological therapy.
So for professionals, what relationship should we have with the technology? When digital therapy came out, many people believe this might replace all the counselors and psychologists and psychiatrists. Some people had been talking about how AI psychological consultation, would that mean that all the therapists would lose their jobs? But in practice, we see that AI therapy does not work very well because human beings are very complex and full of uncertainties. And AI could not accurately look at the changes of emotions. And so it is difficult for them to empathize with humans. So it would be difficult for AI therapy to achieve the desired outcome. But at least today, they can do it. In the future, maybe. So we talk about the relationship between professionals and the new technologies. The new technologies, will the new technologies replace professionals, or will professionals have a new relationship with technology? I believe that the new technology should be seen as tools. All the diagnostics power rests with the professionals. Why do I say that? Because it is still the same comment. Human beings are highly complex, and psychological issues is something that's extremely difficult for humans to resolve, so let alone using machines. So the relationship between human and machines, I believe technology should be a tool for humans. In the future, perhaps there will be a new mode of therapy where professionals would make a diagnosis and would provide digital treatment or prescription. And I believe that is how this is going to turn out. Thank you for the opportunity to answer the question. All right, thank you very much, Mr. Lee, for that. He talked about how there are some technology, many technologies will have a lot of development, and there might be a possibility of digital treatments, and this might help to improve the efficiency and effectiveness of therapy. But the core to this treatment will still be human professionals. So professionals need to become more proactive to harness the power of technology. Thank you very much for that. Because of the time constraint, we have to finish up the Q&A session at this point. We thank the panelists again for their wonderful insights and their sharing. Because of the time, we have now come to the end of this panel. Thank you for the wonderful insights and proactive participation of our audience members. Your participation and sharing had given our panel meaning and had made it a success. Thank you very much, and we trust that you have gained a deeper understanding. It doesn't matter if you're a professional, an educator, a parent, or a student. We need your voice and your support in encouraging and promoting mental health education. We thank you again for sharing with us, and we invite you to continue to pay attention to the CES, and we will continue to provide posts and recordings for Harvard CES public account.